Hello guys, it's me again. So we're going to kickstart now. And like I said, we haven't got a planned agenda. So with this forum is just to gather some ideas, see where your needs are in terms of training, and then we can make a collective decision together moving forward as how you would like this to be run. So I'm gonna put in the chat box again the training needs analysis. I already shared it, but I'm going to share it again. And then you could kindly complete it when you can. If you can do it now, that will be brilliant. So moving forward, it's got some questionnaires in there that from the answers we would know what to do. So I think before I left, we spoke about you guys taking charge for the meeting. In terms of, because if you look at the practice managers forum, it's chaired by the practice manager and she has a co-chair. If you look at the GPN forum, it's chaired by myself, background as a GPN. So it will be really good to moving forward to have one of you. I think it was Zamzam and Adela. So I don't know if they're on this meeting at the moment. Zamzam, are you here? Adela?
No, Adela is here.
Adela, are you here?
Yeah, I'm sorry, I'm eating. I'm not putting camera on.
No, that's fine. So are you happy moving forward to continue to chair the meeting?
Okay, that's fine.
That's fine, right? Okay. So from the training needs analysis, what we would do is we'll go are going to be chaired moving forward. Is Zamzam as well on the meeting? Zamzam? If not, I could speak to her as well. I could speak to the both of you offline. So moving forward, we can decide how we're going to be doing this. So I know some of you, apologies, I haven't been able to reply your email. And I think one of the your kind of needs, it was long-term condition management. I think it was more of diabetes and COPD in relation to spirometry. So don't forget to put that in the training needs. So how are you guys doing? So let's do a wellness check first. How are you guys doing? How are you getting on? What are some of your concerns and challenges that you're facing at the moment? And how can I support you with that? You can just unmute yourself if you've got something to say.
Hi, Amira. It's Anissa. I'm one of the new
Anissa.
HCAs. I don't know if you remember me from it was previously Dr. Krishnamurthy surgery, but now Dr. Bapu's.
Yeah, next to Shrewsbury Road.
Yes,
Yes, I remember you.
Yes. So I've finished my apprenticeship for the nurse advocate. But obviously I was doing the HCA, I was doing the clinics and everything during this period. It's been 2 years of training was this. It's been 3 years now. But they did not give me a certificate to say I'm a HCA, which I don't think they were going to anyway, because the care certificates cover that. Am I correct?
Yeah.
And obviously, the doctor signed me off as well. Obviously, the things that my units, he signed me off. But I've been told now at the end of all this, because I've asked, I know it's not really nothing to do with this, but like you said about the well-being and how we're getting on. I've asked for a proper what's it called? I forgot the word gone out of my head now. Documentation that I forgot the word. A contract, for that as a HCA, because I'm doing HCA, I'm doing clinics as well as being a senior receptionist for them.
Yeah.
And I've been told now, oh well, we can't give you that contract no more because you're not HCA. I was like, how? Why? Does not make sense. But they're saying until you don't give us some sort of certificate to say HCA on it. Sorry, can you hear me?
Oh, I think is it the internet here or something? It says bad connection. I didn't hear the last couple of things that you said.
They've refused to give me to basically sign me up as a HCA now, which is fine. They don't need to, but they're saying, oh, you're not a HCA because you don't have a certificate that says HCA on it. I was like, but that's what my care certificates and the doctor signing me off is.
Yeah, but apart from the care certificate, you were attached to a college, weren't you?
Yeah.
So were you not doing individual modules?
Yep. And that's
so
a diploma for a nurse associate.
Have you finished that?
For the diploma, yeah, we're just waiting on our certificates now.
But so you finished it?
Yep.
So then you are even a step higher than a HCA, aren't you, if you are a nurse associate?
Yeah, but this is according to them, if I don't have a certificate that says HCA, then I'm not a HCA.
How many people have certificates on here that says HCA?
As far as I know, I've spoken to a lot of people and they're saying they don't have one that says that.
There's no, well, previously, I don't know about now, but there's no such thing as having a certificate to say you're HCA. It's going through your modules and being signed off as competent that you're able to carry out. Let's say you do, I don't know, long-term condition management, and then you get signed off with the competencies.
Yeah, I've been signed off for diabetes, blood pressure, hypertensive, CKD, all this. So I don't understand now.
We've got 13 people online, but no one. Sorry, guys. Helen was in a meeting. Yeah, so with that competencies being signed, I don't think you're going to get any documents that will say.
But the competence, the doctor signed me off himself.
Yeah. So that's with the competencies. So what they're expecting you to have, I don't think. I'll probably I have to ask Helen on this, but I don't think there's such thing, unless of course if it's through the college that you finish and then they give you like your GMVQ or your diploma to say something like that. So she was just saying because she's one of the apprenticeships HCA, so she's gone through individual modules and she's been signed off as competent with whatever individual modules that she's done, but her practice is saying that unless she has something that says she's now a HCA, they don't recognize the modules that she's taken.
I see her reaction.
Wasn't it 18 months that you've been doing the program for?
Yeah, it's been over a year ago. The thing is, they're happy for me to do the clinics, but then when I've asked for a contract, saying, so obviously I'm secure with a contract rather than them giving me clinics whenever they find.
So when they let you do clinics, as what? Because if they're not recognizing you as a HCA, what
I'm also seeing housebound patients for them, so I'm going to visit people at home.
But on what title? That's that
HCA.
You're not.
Let's take that offline. I'm sure that we can help you with that.
Thank you.
What are you doing at that for the housebounds?
Sorry?
What activities are you doing?
For the housebound?
Housebound, just review like blood pressure, diabetes, just general foot checks, as I would if they were coming into clinic. Same thing.
Okay. Well, let's take that offline. Mira, can we take that offline and we'll try and
I'll contact you guys by email if that's okay.
Yeah, and
perfect.
Send the module stuff and any of the certificate stuff. And certainly, it sounds like it seems very bizarre because generally we know that practices can convert some of their reception grades in HCAs without any training whatsoever.
That's what they've done, but actually she was one of the trainees. Okay, Anissa, don't worry.
We'll sort
that out.
Thank you.
Did you have email you? No problem, Anissa. Shamsha, did you have anything to add?
I just wanted to say before that we had NVQs and the things which were recognized. If there is a care certificate, and if she's got the certificate, they should take that on.
It's sufficient enough. Okay.
We probably need to understand what their reservations are and just help them understand that it's fine.
Yeah. Right. So anyone else? We sat here by ourselves. I don't know.
We were expecting a thriving forum, but I think it's because you've been away, really, and we haven't been able to encourage people along.
Yeah.
And did they get the time off to come?
That's the thing. Yeah. So, anything else on your agenda?
So shall I just introduce myself?
Yes.
Because I'm not sure that I know everybody on the call. So it's amazing and lovely to have this forum reinstated. It's so long overdue. We really absolutely know that. So my name's Helen Page. I've worked in Newham for 1,000 years, and I'm on secondment from public health in the local authority into NHC, and I've got a role around health improvement. And many of you might know the service that we've been delivering because it's been the housebound vaccinations, and you might have seen the health check stuff that's come back. We also do the roving bus, we've done the care homes, we've done the learning dis homes and a variety of other ones. I also oversee the MDT team and the R's, the personalisation roles, so the social prescribers, the care coordinators, health wellbeing coaches, as well as Mira helping me with the nursing and HCAs. And we're super conscious that both the nursing cohorts and the HCAs have not had the input that they've deserved during the period of COVID, and we are committed to making sure that that changes. So you may or you may not know that actually I started the very first healthcare assistant programme in Newham about 3,000 years ago, and they've been absolutely amazing. But what we do need to make sure is that everyone has their contract of employment, their professional development plan, they've got the opportunities of attending training, that they're reimbursed properly and they're supported properly. And if that isn't being the case at the moment, because of whatever reason, we will endeavour to absolutely make certain that that will happen and develop. So I hope that gives you some reassurance. And we're very keen on supporting people to develop as much as they can do within their roles, because quite frankly, the HCAs who went through on the first programme, some of you are still in post and continue to be amazing in terms of delivering a variety, huge amounts of different roles, responsibilities within the practice setting. And I think the practices would be absolutely lost without you. Is anybody there?
They're there. They're there. I don't know, but they're just a bit
shy,
quiet, overworked.
Okay.
Yeah, but remember the whole concept of this meeting is to get some ideas of what your challenges are. And just like Helen said, she started this training for the HCAs years ago, so she has a better insight as to the support that you need. But we can't decide that for you. You need to let us know. So I'll share again the training needs analysis, get that sorted out, and moving forward we can know how you want to move forward with the forum. How often, because if releasing you is one of the challenges, we might be able to have a discussion with your practices to see how we can work together to make it possible for you to be released. Yeah.
No, absolutely. It's not, we will have a discussion with the practices. We will encourage the practices formally, because of the professional nature of the roles and the support that you need as a group.
Yeah.
How does that sound to people? Does that sound like, what's missing? What would you like us to focus on? Give me one thing that you'd like us to focus on for the next meeting.
I can say something.
Okay.
Yeah, I think that what is missing is the HCAs are not included in any of the forums, not the nurses, not the own forums. There are so many HCAs who are not here still in the meeting, who either are doing clinics at the moment or they are not being informed that these things are happening. So somewhere you need to create a register of all the HCAs who are in Newham specifically.
So have we got a way of doing that easily? Have we got a mapping process?
I can send you the HCA from our 4 sites. And so if all the participants who are here, if they can let us know who else is there and who's working in Newham and are not included in this, we could start creating this sort of registers. I can send you all the details, and then if everybody sends some, we could at least have a group which is missing.
Yeah.
So it's only the people who know that today there is a meeting are able to attend, not all of them.
Yes, because we haven't got an up-to-date distribution, and once we get a better distribution through word of mouth and things, and get a structured HCA forum with speakers and a variety of other things, then we'll start building up that capacity. I sort of get a feel that maybe the HCAs feel quite abandoned.
They have a lot of them have said that to me.
Somebody has put their hand up. They want to speak.
Yes, definitely.
Yeah. Sure. Ismi, go ahead.
Hi, Helen. Thanks for
Hey.
meeting. Yeah, so I would like to say, like, from the HCA, the yearly updated training. For example, before COVID, we used to have like yearly training for asthma review or diabetes food check or diabetes review. So we have the basic training, but every year, what change, what coding, is there any other things that we need to add it on that review or anything? So yearly updated training, these bit a bit like missing.
For the long-term conditions.
Exactly, yeah. So in terms of like the coding, as well as like once we having, because once they're coming, we're asking the similar question. So according to the templates, apart from this, is there any other yearly update or any other new information that we can add it on that consultation? So if you please kindly like let us know. So at least even for half an hour, 40 minutes training or face-to-face online, we don't mind. But I think it's quite helpful for everyone.
Absolutely, and I think that's something we should be able to do for the next month's forum.
Yeah, because if you guys remember, I used to utilize the CCG diabetic team to do reviews before sort of COVID. And I think when COVID happened, it was quite difficult for all of us. So I kind of wanted to have that combination with the GPNs and HCA. And I think maybe that kind of made you guys just feel kind of lost because some of the things was not relevant to you guys. And we do recognize that.
We can't say guys anymore.
We can't say guys.
No, you can't say guys anymore.
Okay. So
you people.
You people.
You individuals.
Yeah. So we do recognize that. And yeah, that's why it's very important to do the training needs analysis. So I know what your expectations are of the forum, and moving forward it will be just something that is relevant to you people and your needs.
Because it also
and of course we're not going to know the answers immediately, are we? We're going to have to revisit some of this stuff and find our way through.
Yeah,
but at least you know that there's an absolute commitment to try and move this on.
Yeah, please, because at least we can ask our practice manager, like, this forum, this is the outcome, so this is the like updated training that we are having, so we can apply from the next clinic, or let also the other clinician know as well. Yeah, thank you.
Pleasure.
Absolutely. So anyone else
brave enough who isn't eating their dinner? No? Okay, so if we are you going to send the link back?
Yeah, I've emailed the link. I've sent it to the WhatsApp group and I've put it in the chat box. So like you said, Shamsha, I might not have the latest distribution list. Please forward it to all your staff, forward it to all your colleagues, and let's get this back. So moving forward from next month, at least we can go through and put on the training that is relevant to you people.
One more question I have is,
sure,
which category the nurse associate would fit in? Is it the nursing one, or they will still be in the HCA? Because I've got few.
How do you feel?
I think it should be the nurses. They should be in the nurses one, because I've got a couple of them here, and they are again not in any of the mailing lists. So okay. I'll send all the details over.
I mean, I think there is significant value of having your own forum for your own requirements, but I think maybe we should do something like every quarter, a combined one, or something like that. So there is some interface, because you're working in a similar area and I think it might be helpful to break down some of those bridges or break down some of those barriers where they are. Does that feel like something that would be helpful?
Yeah, perfectly.
Okay.
Yeah.
Thank you.
Okay.
Noted. Anyone else?
It's okay. You can be shy today, but you won't be able to be shy forever.
Sorry, I have also one more question to my other colleague. Like the training we are having, for example, like the compliance or even the other relevant training that we are having, are we getting paid or we are getting unpaid training to do our own time? I don't know what's the other practice. I'm just asking like what they are going through in terms of the...
For me, I can answer that before everybody else. If it's training associated with your role, if it's update training, it should be paid for within your practice. So it should be part of your core hours.
Thank you, Helen.
Now, obviously, if you're brand new and you want to do 101 different training courses and the practices aren't supportive of that, there's a bit of give and take. But certainly your annual updates should be covered by the practice.
Thank you, Helen. Yeah. Anyone else want to say their opinion, please?
Is that the case for other people? Are they having to do it in their own time? I wonder if people are actually in clinic at the moment. They have this on as well. Well, is that on the training needs analysis? Is that a question?
Not.
No. Okay.
No.
But we'll consider that in the back of our minds
Please.
as the next thing to think about and to plan for.
Yeah. Thank you, Helen.
Any other things you would like to discuss? I mean, you know, in terms of well-being, wellness, anything at all that you would like to discuss so we can sort of share ideas on any kind of challenges or struggles that you may be facing in your practice?
Right now. Hi, Amira. I just want to know, so have we started doing spirometry and peak flows now?
Spirometry, I think the last time you asked, well, one of you asked, there hasn't been sort of a straight answer from anyone in regards to spirometry. What they are advising is individual practices need to make their own risk assessments. Just ensuring that there's enough ventilation, infection control precautions are in place. So it will have to be your practice doing the risk assessment in terms of the rooms that you're carrying it out. I did share something that one of the nurses in City and Hackney put together just to kind of give you a guideline, but they're not saying do or don't. It's just up to individual practices doing the risk assessment themselves.
Is that something that you're doing or helping with?
No, because we haven't started yet doing peak flow, so I had to
because I think spirometry stuff, there's quite a heavy requirement in terms of the training and being signed off and being on a particular register.
Yeah.
So I know that Claire Davidson is one of the NHC GPs, is working with the acute side at the moment at looking at how that pathway can be redesigned. But if your practice is asking you to do that, you probably need to look at the qualifications.
No, in our practice, our nurse practitioner, she does it.
She does it.
Yeah, well, that's actually fine. So you may be supporting.
Yeah.
Yeah, okay.
Thank you.
Okay.
You're welcome. Anything else in terms of clinical aspect of things? Do you have any?
I mean, it's like same as my colleague said, like it will be nice to have updates on long-term conditions now. It's been a while.
Okay, so we'll plan to do that for the next forum.
Care, dressing, something, if there's something coming up for that as well.
Dressings is a problem, isn't it? There seems to be a lot of refocus on the CCG at the moment.
Yeah.
So we can certainly look into that. Is that because you're expected to do dressings and may not have had an update?
Wound care.
Yeah, wound care mainly,
Okay.
They do a lot of wound care.
Yeah. Okay. So maybe is that a more important one than long-term conditions, or shall we blend that for the next forum?
They both are important at the moment. Yeah.
Okay.
Yeah.
But the other thing, Helen, I just need to say something here, that the wound care which is coming out from hospital is far, far more
complicated.
Yeah, then we had seen before. So we are seeing deep wounds.
Sorry,
and we
guys.
don't know. Yeah, we don't know how to look at the deep wound until unless the nurses are around and show us what to do, and then continue the process. But there's quite a lot of deep wounds which are coming out in community, and we don't know what sort of bandages, because as you know, the prescribing bit has come to that click program.
Yes.
And we need to make sure that there's enough orders, and we need to know what sort of things are available and what is the need of the patient, because each individual patient will have a different sort of need and different dressings. So all of that, and the measurements and so on and so forth.
No, I can see that it's a big piece of work. So we'll definitely need to do something around reviewing some of that stuff and making sure that if there is a requirement for that, then we do put on regular training that you can access. Probably not just virtual training, but certainly we'll consider, well, let's review what's due best. I mean, before we used to have viability, is there still tissue viability now?
There is, but there's only not enough nurses for tissue viability, if you know what I mean. So we have. I'm at Church Road, and the center is here.
You can negotiate and do some ongoing sessions. That's going to help them ultimately, because it will share some of that work.
Just to let you know that I have been contacting tissue viability, and they're coming into the clinic to show the nurses and the HCAs what needs to be done. So that is available, but it's just we need to know which patients needs to have that.
I'll take 4 and another pizza. You guys, you are missing pizza because we've ordered pizza for you. And now we've got to eat like tons of it.
We've got 15 of them online. So we're gonna have Helen and we're gonna have the slides for you, and we're literally gonna show you the pizza.
Enjoy your pizzas.
Well, it's face to face and online, but we got 15 people online, and Helen and I face to face. So
we promise pizza if you come out.
They're not going to come out now.
So next time, please come. I've got to go anyway, but lovely to meet you. Thank you very much. See you next time.
See you.
Thank you, Helen.
Bye.
So I'm here. Yes. So I'm here, and we're going to continue off. I know you have lots to say. So maybe what I'll do is, if Johanna, if you could kindly stop recording, because we've captured what we need to capture, and it will be more of an informal chat just to talk about things. Is that all right, guys? Thank you.